Whoops. All right, so the session objectives, we're going to understand the addictive properties of nicotine, recognize the short-term and long-term effects of in utero and postnatal smoke exposure, and discuss the specific effects of tobacco smoke exposure on common pediatric diseases and conditions. Okay, so, sorry, I'm trying to. Okay, so, all right, so why do people use tobacco in the first place? So nicotine, as we all know, is physically addictive, and it causes initially a transient surge of endorphins with a slight brief euphoria when the cigarette is smoked. What's interesting is that this surge is actually much briefer than with other drugs, and tolerance develops really quickly. So I've had a lot of smokers tell me, they've actually explained to me what the physiology is. So initially, after the first year or so they feel really good when they smoke, but then after a year, 2 years go by, they don't feel as much of a rush when they smoke. So truly, they are addicted, but they are addicted a lot to what they're doing, what their hand, what their mouth is actually doing. Withdrawal effects develop very quickly, and and as we know, the withdrawal effects are things like anxiety, tremors, just feeling super anxious, irritability, sweating, nausea. Nicotine is a potent drug. It causes dopaminergic activation and CNS stimulation, and it leads to changes in learning, stress, and self-control. These changes, of course, result in addiction and is what happens when you have withdrawal symptoms. The use is reinforced by social cues and habits as well. Okay, so when after smoking the first puff, nicotine in the first 1 to 2 puffs occupies about 50% of the nicotinic receptors in the brain. And nicotine goes to the brain within 6 seconds after inhalation. Smokers can control their brain nicotine level, though, by how deeply they inhale, how much they inhale, how many puffs they have. They can do the same thing with vaping, by the way, and other behaviors as well. Okay. And there are, even though cigarette smoking, as I'm sure you all have heard, has gone down tremendously, there still are around 34 million Americans who still are smoking. Smoking remains high among many subgroups, including men, including adults 25 to 64 years old, including those with lower education, including those who are below the poverty level, those in the Midwest and the South, right where we are, those who are uninsured, those who are on Medicaid, those who are disabled, those with serious psychological distress, very high in folks who have schizophrenia, very high in American Indians, probably the highest in the country in American Indians, Alaska Natives, and multiracials, and high in those who are LGBT. So there still are a lot of deaths due to smoking. More than 480,000 US deaths every year are from smoking. Heart disease is the #1 cause with about 33%, lung cancer about 29%, COPD 21%, other diagnoses 7%, other cancers 7%, and stroke around 3%. So smoking during pregnancy is still quite high. There are about 12% of mothers report smoking during pregnancy. In certain populations, definitely much higher than this though. About 50% of mothers will quit during pregnancy. And again, I've seen many research studies that show this to be higher or lower. About 80% will relapse shortly after delivery. So in terms of problems attributable to maternal smoking, so maternal smoking results in 5 to 8% of preterm deliveries, 13 to 19% of low birth weight deliveries, and 23 to 24% of SIDS or SUIDs. Secondhand smoke causes SIDS. We know this, that if you smoke during pregnancy, your child is at increased risk for SIDS. Infants exposed to secondhand smoke after birth are also at greater risk for SIDS. And infants who die from SIDS have higher concentrations of lung nicotine and higher levels of cotinine. Cotinine is a measure of how much smoke they are actually exposed to than infants who die from other causes. Those whose parents have smoked during pregnancy have an increased risk for asthma, wheezing, airway hyperresponsiveness, birth defects like cleft lip, cleft palate, heart defects, webbing, SIDS, and SUID. And then later outcomes of maternal smoking during pregnancy, even if mothers smoked during pregnancy and they stopped, there have been research studies that have examined children 5 years, 6, 7, maybe even 10 years later, and show that those kids are still at higher risk for having behavioral abnormalities. So they higher risk of ADHD, for example, learning disabilities, lower IQ, higher risk of obesity. And of course, these effects are still associated if the parent goes ahead and smokes later and the child is exposed, these risks continue to happen. So like I mentioned, postpartum relapse to smoking is a reality. This says 50 to 60%, but in the other slide, rates have been shown to be up to 80% return to smoking within 1 year postpartum. So these are opportunities for pediatricians and OBGYNs, of course. And if you happen to have a prenatal visit, you can determine the mother's intentions to, are they going to smoke again when they deliver the baby, or what are they going to do? Smoking rates in Ohio are higher than the national average. So the adult prevalence of smoking in the US is about 16.3%. In comparison, the rates in Ohio are about 22.5%. Rates of smoking during pregnancy are 7.2% in the US overall, compared to about 14.4% in Ohio. However, even though national prevalence is better than Ohio, the overall rates are still too high because the Healthy People 2020 goal is about 12%. So we are not meeting that. So this slide shows a recent study that looked at 2011 to 2012 NHANES data. And it shows here that 30% of children 3 to 11 years of age had detectable cotinine levels. So that means they were exposed to tobacco smoke exposure. Now, this overall percentage is down because in 2007 to 2008, the percentage was about 54%. So that is a marked improvement, but 38% is still way too high for kids to be exposed because that actually represents about 14 million kids 3 to 11 years of age are exposed. Very high numbers. You can see even low levels of smoke exposure can cause many illnesses in children, as we all know, including ear infections, more frequent and severe asthma attacks, respiratory symptoms, bronchitis, pneumonia, bronchiolitis, SIDS, and increased conduct and other behavioral abnormalities. So this slide shows some of, this actually is a takeoff of the data that we just saw on the previous slide. So also from NHANES analysis, this shows that tobacco smoke exposure in certain sociodemographic groups, it definitely has declined from 1999 to 2000, as you can see with the light colored bars on top on each of those, on each of the figures there, each of the bars there. But it shows that there are increases in those in certain subgroups. So for example, tobacco smoke exposure was particularly high in non-Hispanic Black children. So that's the second from the top, you can see there, the second row of blue bars, from children who are from low income homes. So that's the yellow bars, and children who live in rented housing. So in general, that's multi-unit housing, as you can see with the green bars. So what is secondhand smoke exactly? So secondhand smoke is the smoke exhaled from smoking, or it's a smoke that results from a burning cigarette. So if the cigarette is, being smoked or is lit right here, that would be secondhand smoke. Usually lasts about 10 to 20 minutes or so. The first mention of secondhand smoke was in the Surgeon General report in 1972, was recognized as harmful in 1974 with the first full report in 1986, which, thinking about it, is kind of late in my opinion, but that's reality. From the Philip Morris Tobacco Company's own research, they showed that secondhand smoke is 3 to 4 times more toxic and 2 to 6 times more temerogenic than mainstream smoke. So mainstream smoke is what the smoker is actually experiencing. So that's pretty significant because secondhand smoke is what our children are experiencing. This graph shows this, the table shows the effect of a single cigarette on indoor air quality. So it takes about 2 hours for the air quality to return to minimum federal safety standards for levels of carbon monoxide, fine particles, and particulate aromatic hydrocarbons. So it takes a while for that to go away. This I thought was an interesting picture from the CDC that shows what happens with tobacco smoke exposure in multi-unit housing. So as you can see, secondhand smoke can infiltrate into other units through hallways, through stairwells. It can go up pipes, it can go through vents, it can go through little cracks in the floors. It can go all over the place. So I will often use this when I'm talking to parents who feel like, you know, well, okay, say they live in a single family home. They live in a single family home. They say, but I only smoke in one room. I only smoke in the bedroom. I only smoke in the bathroom. I keep the door open, or I, keep the window open. I keep the fan on, but it's still getting in the house and it's going throughout the house. So you need to tell them that and let them know that that is still happening. There's lots of stuff in a cigarette itself. It's not just the nicotine that is causing the tobacco. If you could look at all these, I won't read all of this here, but there's over 700 chemicals that are in a cigarette that are bad for children or anybody to be exposed to, including arsenic and methane and cadmium and toluene, all sorts of bad things in it. Okay, this shows the life cycle of harm from tobacco use. So if we start with the pregnant mom there, so if you smoke during pregnancy, your baby's at risk for low birth weight, stillbirth, neurologic problems, decreased lung growth, and asthma. In infancy, exposure results in SIDS, bronchiolitis, meningitis, other illnesses, childhood asthma, otitis media, fire-related injuries, adolescence. Of course, parents who smoke are modeling smoking for their kids, so their kids are more likely to smoke. And if the child starts to smoke, then that's the problem, because when teenagers smoke, they're more susceptible to nicotine than older folks who are smoking. So they're likely to be hooked for life. And then, of course, if you continue smoking as an adult, that will result in cancer, cardiovascular disease, or COPD. So this data is a little bit old. So I'm thinking that the numbers are probably a bit higher. But annually, secondhand smoke exposure results in 200,000 cases of childhood asthma, about 150 to 300,000 cases of lower respiratory illnesses, 800,000 middle ear infections, 25 to 72,000 low birth weight premature babies, 430 cases of SIDS. There was a meta-analysis done in 2012 that showed that smoke exposure postnatally increased the risk of middle ear disease to about, if the mom smoked, about 1.62 times increased risk. If any household member smoked, about 1.4 times increased risk. Both maternal and paternal smoking increased the risk of needing surgery. So 2 for middle ear disease was about close to 2 times higher. A large epidemiologic study in Italy of 2,200 infants, they showed that infants who were exposed to smoke had a 5.4% increased risk of being hospitalized for bronchiolitis. Prenatal exposure increased your risk of bronchiolitis hospitalizations by 3.5 times. Postnatal exposure increased your risk by about 1.7 times. There was a study done by Wilson in Colorado that looked at kids who were hospitalized for influenza who were exposed to secondhand smoke, and she showed that those who were exposed had a longer length of stay, about 70% longer, and increased rates of PICU admission, so 7 times the baseline rate. Secondhand smoke is associated with greater prevalence and severity of asthma, so increased need for inhaled corticosteroids, increased dose of steroids, and secondhand smoke exposure results is related to readmission for asthma as well. Other studies have shown that tobacco smoke exposure is associated with increased inflammation, so higher CRP levels, lower HDL, higher blood pressure, and increased risk of metabolic syndrome. In another study, it shows that non-asthmatic adolescents who were exposed were at increased risk of shortness of breath, finding it harder to exercise, wheezing during or after exercise, dry cough at night, missed school due to illness, poor overall and physical health, and increased risk of ED or urgent care visits. And then, of course, it increases the risk of adult disease. So those who are exposed have a higher risk of lung cancer and leukemia, heart disease, lipid disorders, and metabolic syndrome, and of smoking themselves. And I also wanted to introduce something about third-hand smoke. So Third-hand smoke is a complex, dynamic, persistent, and toxic mixture of tobacco smoke pollutants generated from secondhand smoke. It remains on home surfaces in dust, on smokers' skin, and in objects. It's re-emitted back into the gas phase from reservoirs storing pollutants. It's resuspended from accumulated fine and ultrafine dust deposits. And it reacts with oxidants and other compounds in the environment to yield secondary and tertiary pollutants. So you can tell parents, even if they smoke outside, it's not enough. They're bringing their jackets inside, they're bringing their bodies inside, and it's sticking to them. The smoke is sticking to them, and it is mixing in the dust. It's mixing on the surfaces, especially if they have young babies who are crawling around or putting everything in their mouth. Their kids are going to be exposed to third-hand smoke, and this stuff doesn't go away. This slide shows some examples of third-hand smoke. You can see the yellow on walls. You can see the yellow on some teeth and on a teddy bear and on a cloth that was just wiped on a surface. And you can see, hopefully, the yellow on the smoker's fingers and yellow on the plate. Additionally, there are clinical concerns associated with third-hand smoke. So we assume, we don't know for sure, but we assume that third-hand smoke exposure is going to cause the same stuff that secondhand smoke causes. So probably respiratory symptoms and diagnoses, probably infectious related illnesses, probably neurodevelopmental conditions. And then in addition, the exposure is, these chemicals are staying and they're converting into carcinogenic materials that are exposing kids for a long time. So kids are probably chronically exposed to this. So just another tidbit that you can give to your families. I think that is all that I had.